Dr. Jenny Jaffe. I'm the medical veterinary director.
My name is Andy Kirsch, and I'm the chief medical counsel for Project Chimps. Probably about 4 or 5 years ago, Ali Crumpacker and I and my wife Susan, who's a child adolescent psychiatrist, got together to kind of talk about the needs of Project Chimps. And at that time we put together a council where we were able to help the veterinarian here at Project Chimps and get experts from Atlanta, mostly from Children's Healthcare of Atlanta, where we were able to get specialists in plastic surgery like Dr. Joseph Williams over here, and psychiatry, Susan Kirsch, gynecology, and really just every subspecialist that you could think of we have available to the center, because a lot of these problems that are seen in primates overlap with humans, and so it's really great for the chimps and it's great for the whole team to feed off of each other.
My name is Joe Williams, and I am a pediatric plastic surgeon down in Atlanta at Children's Healthcare of Atlanta, and I've worked with Andy Kirsch for too many years. Andy asked me to come up and have a nice quiet weekend at his place up here in the mountains, and next thing I know, we're walking around this facility and he's talking to me about maybe being part of the team. So I hesitated about 2 seconds and said, "This is fantastic, what a wonderful idea," and I have had the pleasure of being involved with this facility and this organization for the last several years.
When I arrived here in November last year, the consulting vet, Dr. Jim McGrath, had already told me this is Kevin, he has this facial mass or swelling. He had already biopsied it. It turned out not to be anything cancerous. It had arisen within a few days, so that isn't very typical for cancer anyway. And Dr. Jim had done x-rays and he had taken a punch biopsy, and it didn't show anything too specific. Also, it looked like cartilage and it looked like inflammation. But you would normally expect that just to calm down over time. But instead of completely calming down over time, it had what I call a waxing and waning inflammation. So every few months, the swelling would be a little bit more pronounced, and there would also be a little bit of a drip, drip, drip of discharge from the point where they had taken the biopsy. When I saw it kept coming back, I thought, yeah, we cannot leave him with this swelling in his face that also keeps reactivating every few months. We assume the initial swelling started because of an injury, a fight with other chimps. That's almost certain. So the anesthesia actually went very well. It took us some time to convince Kevin to allow hand injection. So we train all the chimps to allow hand injection, but when the day comes, some of them might not be as eager and willing as on a normal day. But in the end he did, and our behaviorist Chris took the opportunity very quickly, give him the injection with anesthesia, and he went down very well. And then we had 2 human surgeons that I had invited, specifically Dr. Joseph Williams, or Joe Williams, who is a senior plastic surgeon at Chateau in Atlanta, and we are very lucky that he was willing to come up and do this surgery with us. And then he had a second surgeon, Andrew Kirsch, who is the head of our medical council, and he had 2 assistants as well. And I had even invited chimp vet tech from Emory Primate Center as well. And basically when I said Kevin is under anesthesia, they prepped the area. So they made sure it was as clean as it can be. And they made an incision of the skin where the old biopsy site was, so where we had seen the drainage. What almost a year ago had looked more like cartilage, now it was hard bone. So new bone had formed where the initial injury had occurred. They made sure that any little blood vessel was cauterized, and then they put the tissue that they had removed in little pots with formalin so that we could send that off to the lab. And then they sutured everything closed. Then we gave Kevin an injection to make him wake up again, and he woke up quite quickly. And within an hour, he was already climbing around. What is typical for chimps is that when they have suture material in their face or in their foot, anywhere that they can reach, they will try to kind of pick at it. That's how they normally deal with any type of injury. And so Kevin was also picking at his incision, and he did pick out the skin sutures. We know that is a possibility, so we were prepared for that. And by now, it looks quite nice. It's nice and dry and has mostly healed, but it will take a few more weeks. Mainly what I'm looking for is he'll still have a bit of a raised area on the right side of his face, but what we want to see is no more discharge, no more waxing and waning swelling of that area.
So my daytime job is a pediatric urologist. And that's really the link that I had to Project Chimps, because they want to kind of control the population. So vasectomy was the operation that we were interested in first. But whatever comes up, we'll get involved with. So what did I learn today? Well, I think much like a children's hospital, the staff here is great. Everybody is so concerned about the welfare of the animals here at Project Chimps. The same type of thing happens in a children's hospital. It takes a village to take care of these animals, and we're just so honored to be part of that, to help these amazing creatures.
I would agree. I think so much of the work around an operation like this has nothing to do with what we do at the operating room table, but what happens before and after. And there's so much effort that is made to make things as natural and comfortable as possible, and both before and after. And just the process of putting Kevin to sleep, really just admirable, the work that went into making this as easy a transition for Kevin as possible, both before and after. I think that the thing that probably struck me the most was, and this always happens, it's just how human these chimpanzees are. They have their own personalities. They have family around them that care, that are wondering what's going on and wait, just like parents at Atlanta, to make sure that everything is okay.
It's quite amazing just to see how concerned the other pod mates are, that one of their brothers is going to go away from them and have a procedure, and they really seem to understand a lot of it. Just today, just learning how they present their arm to get an injection, is quite remarkable. That they really understand what's going on, and so that just means we need to be extra cautious and be very gentle and humane to these animals.
I'm specifically very pleased that we got these two top surgeons, and because they are interested in how chimpanzees are both similar and different to humans, they were willing to donate their time, and we really got to benefit from a very experienced surgeon, something not all sanctuaries have the luxury of having access to. So we're very grateful to Joseph Williams and his assistants, and it's really nice to see that synergy of human surgeons and veterinarians.